Cancer screening rates are becoming significantly lower in federally qualified health centers for low-income communities. This is the finding we're learning from a newly published JAMA internal medicine study. To get a better understanding, postdoctoral fellow and Dr. Trisha Amboree is joining me to share details of this study. Okay, so basically, what did I just read? What does this mean? This study, what's it saying? That people in underserved communities aren't getting cancer screenings?
Yeah, that's exactly what it's saying. Federally qualified health centers tend to service those who are under-resourced. A large part of the U.S. population actually is served by federally qualified health centers, and what we found is that relative to the general U.S. population, cancer screening, namely breast, cervical, and colorectal cancer screening, are all much lower in these settings than in the general U.S. population.
So somebody who goes to a federally qualified health center, they are not going to be offered these screenings, or they're not taking them? Which is it?
Well, we're not entirely sure what's going on. I do think more research is needed to fully understand why that gap exists. But we do know that federally qualified health centers are historically under-resourced. And so the effort would be to improve resource allocation and funding there to scale up screenings in these settings.
Just so people have an idea if this impacts them, a federally qualified health center, is that any low-income health clinic?
Not always. Federally qualified health centers are funded by the government, and there are about 1,400 of them across the U.S. And so it's not just low-income clinics, but they tend to be more lower-resourced settings.
And so the cancers that you mentioned that they're not getting offered the screening as much as other clinics would be offering their patient, is it because they don't have the resources? Like, for instance, cervical cancer, is it because they can't do a pap smear in that clinic or something?
It's not because they can't do it. I just think that resources may be limited to be able to do things as much. And so efforts need to be placed on what does it look like to implement equitable, evidence-based interventions so that we are improving screening in these settings.
And what would that look like? Like, what would your suggestion be?
Well, first, I think there's going to be a need for more research to fully understand what's happening. Is it that it's being offered less, or is there something else going on? Or also funding allocation and resources to improve implementation science. So implementation science is actually getting into the clinics, looking at what's going on, and seeing how we may be able to intervene in a way that is going to be helpful for the populations that we serve. And so we are calling for more resource allocation towards implementation science so we can fully understand what's happening.
And when we're looking at these clinics, then we're probably looking at families who are low-income families. Mm-hmm. Are we talking also about mainly Black and Hispanic people?
Yeah, federally qualified health centers tend to service minoritized communities, whether that be the underinsured, the under-resourced, or lower income, as well as racial and ethnic minority populations.
And what percentage should be offered cancer screenings? Like, what would you like to see?
Well, there are national targets that are set for each cancer screening. So I know for the goals that we have set for 2030, they're roughly in the upper 70s to 80% of people should be up to date on their cancer screening. Mm-hmm. Right now, what we're seeing in federally qualified health centers is that number is somewhere between 40 and 50%. So it's much lower than our targets.
In some cases, almost half as many are not being half, not a good thing. In the wrong direction.
Yeah, unfortunately.
Yeah. So so what would some interventions be that you can think of? Mm-hmm. I'm asking because I interviewed you before talking specifically about cervical cancer, and we talked about the challenges that women face to get screenings like that. Mm-hmm. And you did come up with one good suggestion last time. Tell me if this would be the same for this, but having cancer screenings, multiple cancer screenings available at one visit, so that people didn't have to make multiple appointments, get childcare for multiple appointments, leave work for multiple appointments, and could do everything kind of in one day. Is that still a recommendation that you would make for something like this?
Yeah, I think there's definitely more research to be done around what it would look like to bundle cancer screenings, as well as what would it look like even for self-collection. You know, with colorectal cancer screening, there's the opportunity for self-collected samples. Similarly, what would that look like for cervical cancer screening or other screenings that would allow for self-collected samples? So people either don't have to take off work as much to come in, where we can bundle screenings, or where people may even be able to do screenings from their home. So these are research ideas that are being looked at right now.
Do you believe that would save people's lives?
Absolutely. I think if done correctly, if implemented correctly, the more screening that we can do and the better the follow-up care, then the better outcomes for people.
Yeah, and I was actually talking to MD Anderson yesterday about a different story, and we talked about how lowering cancer rates in our area lowers health costs for everyone. So really, this is a huge public interest.
Absolutely, absolutely. And specifically in federally qualified health centers, if you can improve screening there, you're looking at mitigating or lessening health disparities in the U.S. On under-resourced communities, and so it's very important.
I mean, this is the main reason that we have health disparities, is because screenings are lower in underserved areas.
Yeah.
That's the whole definition, basically.
Absolutely, absolutely, yeah. So that's why our major call to action is, hey, we have to do something about this. We have to improve our research, our science, our funding, our resources to make sure that we are improving screening and prevention in the communities that need it.
Yeah, well, you've released a really eye-opening study, and so we do appreciate all the work that you're doing. What would you like people to know about this? I mean, as this study is, now available to the public and the embargo has been lifted, nationwide, people know about this information. What do you want them to take away from this?
Well, as the public, I would just say if you do have access to a healthcare provider, if you do have access to a usual source of healthcare, be sure to check in with your provider of when is best for you to get your cancer screenings. But in the event that you are part of the population who does not have adequate access to care, know that we are working on ways to improve access to care for you. Is
there a place that they can go and get that screening for free to them right now?
For free, I'm not sure. I think that would depend on a lot of factors.
Well, we're reaching for the moon here.
Yeah.
Can we land among the stars? Are there health clinics that do offer these screenings that you know of?
Yeah, in the Houston area, we have federally qualified health centers here. We have community clinics. So that should be relatively easy to find by going on Google if you can and seeing what clinics may be in your area.
Yeah, okay, just so people know that maybe if they haven't been offered this, that they can still seek out treatment.
Yeah,
this doesn't have to be the end of the line for them.
Yeah, no, absolutely.
All right, very good. Trisha Amboree, is there anything else that you'd like to add before I let you go?
No, I appreciate you all for having me.
Really good information, a really good eye-opening information for people who, as we mentioned, if you go to a federally qualified health center and maybe you haven't been offered these cancer screenings, it's a good idea to realize that now and go seek them out. All right, Dr. Trisha Amboree, we appreciate you coming in live to the studio this morning.